Well, again, good afternoon, everybody. I am always humbled that you take the time to be here with me. I really am. It's all of you that I've always said I learned from, and I just like to share information. And so there's a lot of new people on today, and there's a lot of wonderful people that have been with me for years. And so we're going to start the beginning of this class with a little bit of a review, but trust me, this is a solid protocol for pain and inflammation, and we're going to even take it beyond that for you as well. Part two is a brand new product that is being launched soon. Okay. Listen in. You're the first to know about this. I showed you a couple slides of it in our last Daniels downloads, but this is going to launch really soon. So do not, I'm going to preface this right at the beginning. Do not call Biotics Research. I love that you're interested and say, can I get that? I'm going to announce it to you when it is released, but you're the first to hear about it. Everyone at Biotics Research is super excited about this product. We're all like, can't wait to get it, want to take it myself. It's one of those kind of products, and you'll see the science. It's really great. So today is July 24th, 2025. For those of you that will listen to the recording later, we're going to go over pain and inflammation protocols. 35 minutes. We're going to keep it clean, but I'm going to give you some solid information. Be aware that we are now doing a podcast. And the reason I thought of this is my morning was recording a podcast for Biotics Research. So here's where you can go find it, Wellness Unfiltered Pro, kind of a long name. If you need further details, I'll send a link in the follow-up email as well. But today we actually discussed part one of glandular therapy and what makes Biotics unique and some of the applications of the product as well. I know I talked about liver tissue. It's really solid, amazing science. The literature's out there, but that will be posted. But you can look at our past podcasts we've already done. All right, let's dive in. Many of you have seen this slide before, but I want to refresh that even though we're all in the supplemental world, and I appreciate all of you utilizing Biotics Research, as many people have told me before, it's what goes in the tube. What are we eating? And I've shared this slide many times, but it's such a powerful slide. I think this is a powerful slide to show your patients, or at least tell your patients about. High fat, high sugar diets cause inflammation. Now, you know this. We've talked about the seed oils, the everything. But look at this. A single meal of eggs and sausage muffin sandwich and 2 hash browns cause an increase of 150% of NF-kappa B. NF-kappa B, many of you have heard this, you know this, is your inflammatory enzyme, okay? Which lasted for approximately 2 hours. One breakfast, 2 hours of inflammation that was associated with an increase in oxidative stress and an inflammatory marker CRP. Your patient, your clients, let's say they go to a primary care doctor and they run their CRP and go, my gosh, your CRP is really high. Your patient may be just eating like absolute crap. So the increase in intranuclear factor kappa B and decrease in inhibitory kappa B in mononuclear cells after a mixed meal. So this is a legitimate study out of the American Journal of Clinical Nutrition way back in 2004. So we've known about inflammatory foods all along, but here's proof. One breakfast increased CRP in their blood. And we've showed you this. This is the American diet. This is a real item at Walmart. Deep fried Twinkies. I mean, look at that. It says enjoy hot. Oh my God. Can you imagine what happens when that's warmed up, especially put it in a microwave? But we have to understand that many of your patients are doing this. They're eating like this. So why are we so inflamed? This is obviously a very short discussion of some primary nutrients to consider. We could really do an 8-hour talk as always on everything we've discussed. Here's the chart. Many of you have this chart. I'm going to send it out again for those of you that are new. I would recommend printing this chart because this chart shows the patient. They're not looking at you. Visuals, as you see, make sense instead of us just verbally telling the patient you need to eat better or you need to do this better. When you can show them the pathways of, on the left side, Diet and lifestyle choices, stress. Hello, huge. Injury. But here, food and environmental allergens, viral infections, consumption of macronutrients such as sugars. We showed you that slide on the breakfast. Nutrient poor processed food. What does all that do? It activates this inflammatory enzyme, just as it showed in that study on the breakfast, NF-kappa B. When we activate that enzyme, we activate all these pro-inflammatory cytokines. You learned about cytokines a long time ago. Your patients learned about cytokines when we had this virus kind of take over the news. And then you had clinical manifestations of pain, inflammation, poor health. This is how it happens. Look at the top. Caparest, a product we're going to discuss next, inhibits NF-kappa B. We know vitamin D does that very well also. There's a lot of nutrients that inhibit this inflammatory enzyme. And then further down the pathway, we're going to discuss Intenzyme Forte. This is the review of the two products, and then we're going to get into the new product. Stick with me because I'm going to share you some silver bullets here, okay? So here's Caparest. Many of you say, well, what's in Caparest? You have your curcuminoids from turmeric, your boswellia, ginger, rosemary, bee propolis, green tea, resveratrol. You see all this in the slide here. These ingredients have documented activity in reducing NF-kappa B. You saw that in the chart. That's inhibiting that pathway to decrease all those pro-inflammatory cytokines. So as you're listening in, think of your patients. I saw a chiropractor just hop on here. Your patients are in pain. They come to see you. You adjust them, but they still have pro-inflammatory cytokines. Your patient eats like absolute crap, like that study we showed. They have pro-inflammatory cytokines. Ideally, you're working from that level while you're utilizing products like this to reduce the inflammatory response. Here's your dose. 4 to 5 capsules twice a day, acutely as a loading dose, then 2 to 3 for maintenance. Right? You're going to get these slides, take those notes so you know the dose. Here's the silver bullet, segue, sideways silver bullet. Daniel goes off topic sometimes, but you have to know about this. This is really huge with what we are experiencing in today's world. When we inhibit NF-kappa B, NF-kappa B inhibition, right at the top of the slides, blocks viral replication. Okay, so I should have said this in the beginning. These protocols, these treatments are not used to, diagnose disease per, what we have to say. With that said, if you have a long hauler where their immune system has been trashed, they have a foggy brain, they have chronic fatigue, pain, and you've done everything, consider this. This is part of the long haul program. This is also back to the basics of you got sciatica, you got, any knee pain, you have general pain, Caparest fits in there, but also because we're blocking viral replication when we inhibit this NF-kappa B. What I want to show you, because it's been a discussion a lot lately, you'll get me on social media, Holy Toledo. These Instagrammers, these TikTokers, and many are very good, and many of them are brilliant doctors like you, but many of them are in it for a quick buck. And I'm old and cranky, and I'm really tired of that because you have patients that trust you and spend money with you. And so showing you this slide is we at Biotics Research look for residual solvents. So here's turmeric root standardized extract. That's your curcumin. You take turmeric, you use a class 1 solvent to extract curcumin. Many don't know this, okay? But you have to get rid of that class 1 solvent so you have clean material. We assay for that class 1 solvent. There it is, class 1 solvent. The USP allowable limit of what's allowably left is 5 parts per million. What we have found is 139 parts per million in curcumin. That's a batch we reject. As you know, I've mentioned this before, at Biotics Research, every time we buy from a supplier, no matter how long we've used that supplier, they send us a certificate of analysis. Doesn't matter to us. It still goes into our ISO certified laboratory for testing. This is the due diligence you're getting out of us. So we're looking for that class 1 solvent. That's material we reject. The question you have for your patients when they say, well, I took curcumin, I got it at XYZ store. It was really cheap. You bet it was cheap because it's probably the material we rejected when you're trying to use an anti-inflammatory nutrient like curcumin. But now we've got an inflammatory disease process causing class 1 solvent. These are things, respectfully, to ask your suppliers if you're using other sources. And I get it. I'm not saying we are the be all end all, but I am saying it is a buyer beware industry now more so than ever before. So the second nutrient I love for pain and inflammation. This is old school foundational nutrition. One of our first products, proteolytic enzymes. Here we go, as I was discussing on the podcast this morning, and I've discussed before, we tend to get out here with fancy pathways of nutrients that have been modified, and it's great, don't get me wrong. Those and we're going to show you actually one that's very specific. Okay, but we forget about foundational components. This is foundational nutrition. Many of you know about proteolytic enzymes. Many of you use Intenzyme Forte. But each tablet is a source of animal and plant proteolytic enzymes. Okay, you have pancreatin here, bromelain, lipase, amylase, papain. So it's effective for systemic inflammation, tissue damage, arthritis, poor circulation due to inflammation. In this laptop that this presentation is on, I have pictures, and I've shown them before, of a diabetic toe, pretty much gangrenous toe, that was going to be amputated. And I have documentation of it being saved using proteolytic enzymes. Now, did they need a ton? They did. But did it save their toe? It did. Yesterday, here's just giving you processes to think of application. I was meeting with a nurse practitioner who does a lot of aesthetic work, and we talked about, the skin, the biggest elimination system, all those kind of factors. But also, he was always sending people out for bromelain post cosmetic procedure. And I said, you have Intenzyme Forte sitting on your shelf. And the answer was, oh gosh, I forgot. So this is why we do this. This is why I love to do this, is reminders for us I don't really forget I forget how to use this. Where could I use this? Intenzyme Forte is a wonderful anti-inflammatory. That is, by the way, the side note, we talked about Caparest for long haul, Intenzyme for your long haul. The dose, write this down because I don't have it in the slides. 5 twice a day. 5 when you wake up before food, 5 when you go to bed away from food. Do not take it with food, otherwise you have a very fancy, a little bit pricier digestive enzyme. Maybe your patients want to do that too, but this is not the point. The point is away from food in all cases that I'm going to show you today to work as an anti-inflammatory. What do proteolytic enzymes go in and do? Why is this part of the long haul program? We are breaking down foreign proteins. What is a spike protein? A foreign protein. So in the pain and inflammation protocol, put these two together for your long haul patients who have all these inflammatory cytokines, potentially these spike proteins floating around. You're going to have great success. You see the bottom line of this slide. I put any-itis, phlebitis, any thing that ends in itis. I got the question just the other day. That's why it reminded me to put this in here. Plantar fasciitis, itis, an inflammatory process. Any itis, excuse me, always think of proteolytic enzymes and Intenzyme Forte. We have a 50 tablet jar, we have a 100 tablet jar, we have a 500 tablet jar. So a couple little silver bullets here of why Intenzyme Forte and how it can be so effective. Bromelain. Many of you know and love bromelain, a potential therapeutic application in COVID-2 infected patients. Interesting. Here's your pathway. Here's the SARS coming into the ACE2 receptor. Here's your pro-inflammatory cytokines. You keep hearing me talk this message of the cytokines. I think we're all inflamed at some level from factors of, as I showed at the top of that list, stress just can do this. So much about gut health could do this. But here we're helping it. Look at, here comes bromelain, inhibits this pathway. These pro-inflammatory cytokines going down to reactive oxygen species. That's where bromelain helps so well. But here's just a couple little studies for you. Now we're going to go into the athletic world. Talk about pain and inflammation with your patients. I saw a lot of great doctors on here who treat a lot of pain patients. The double-blind study investigated the use of enzymes in ankle joint injuries. The enzyme group experienced faster reduction of swelling, faster return to joint mobility, and decreased pain during resting or movement as compared to a placebo group. Look at this. The time during which patients were unable to work or train was significantly shorter, reduced by some 50% with enzyme therapy. I know we all love brand new studies, but this is 1990. What I like about that is this has been known for a long time. Very effective nutrients. Since orally administered enzymes have very few undesirable side effects, can't think of any, except if you have a diabetic patient with a diabetic toe and you want to help them, you're taking so much Intenzyme, you probably don't want to leave the house because you're going to cause a loose stool. You will not cause a loose stool at 5 twice a day or 5 3 times a day, okay? But you start increasing the dose, because I know there are some physicians that work in the disease world that will use 8 tablets 5 times a day or more to work on processes where enzymes go and break down foreign proteins. So, with the very few undesirable side effects, this treatment is suitable for all patients with sciatica due to invertebral disc herniation. That's a big deal. I've been there. It's painful. So the clinical benefit is presumably due to the decrease of inflammatory edema in the nerve root. Clinical results have been spectacularly good. 1971. And yes, I was born before that. So, absolutely silver bullet pain products. If you need further details, please, you know how to reach out to me. Cell phone, call me, text me, email me. Happy to do a one-on-one Zoom with you, whatever it takes so you feel comfortable about the application of these, because I feel very confident from the subjective response that you all give me that this is a solid program and the science is there. So again, as a refresher, here's your Kappa Rest. Here's your Intenzyme Forte, helping this entire pathway to reduce the clinical manifestations of pain and inflammation and poor health. I'm going to send this chart to you because I think it's a great chart to print. I have doctors that use it and show it to their patients. Part 2, Biomega SPM. Now, as a refresher, I knew I talked about it at the beginning, but a lot of people have just hopped on. This product is not available yet. You are the first to hear about it. Sometimes I have the little bit of a luxury of getting notified of things. I'm like, I'm going to do this. And they're like, no, you shouldn't. But I'm going to do it because I appreciate all you. I get excited. You know this. I love helping your patients. And I will notify you when this comes out. I'm going to tell you when. I'm looking in about 3 weeks, I'm hoping. Okay. So this is a little premature, but I want you to get excited as I am about this because I know Daniel right here is going to use this product himself. You may be familiar with pro-resolving mediators and you may not be familiar with pro-resolving mediators. There are some in the industry, but we're going to show you the difference and we're going to be very truthful about labeling on these products. So the problem is inflammation. Look at this. 51.6 million US adults seek comfort and healing due to inflammation. You have these patients. I'm sure you have your protocols that are great and tend to help, but I want you to take a look at this one, what's coming your way. 1 in 5 people are globally affected by pain, a growing demand on new solutions. I have an MD friend out there that I'm aware of that is all about pain in the allopathic world. He's exploding in business. Okay. So you, as a practitioner, clinician, doctor, should be aware of the number and be excited to present your protocols to these patients who are tired of the heavy medications that are kind of more band-aid medicine than what we have to offer. The solution, here's Biomega SPM, is more than an anti-inflammatory. So this is a different pathway than what I've showed you. That's why I like both of these to have in your toolbox. Targets acute and chronic patients. My gosh, that's a great thing to have. Broad application from injury to arthritis. Here's the difference. In red, we will have 7 specialized pro-resolving precursors, the most in the industry. There are some already out there, but they only have 3. Okay. 500 micrograms per serving is the most in the industry. Who's your target patient? Look at this, just so you don't even have to question it. Chronic inflammation. I think we're all aging. I've been at this for 30 years, so I know I'm aging. Periodontitis. My gosh, who would have thought? Cardiometabolic, obesity, colitis, IBD, acute inflammation, infection, trauma, burns, wounds, allergies is an inflammatory response. Stay with me here because this slide gets a little like, oh my God, that's a lot to look at, Daniel. I'm going to really hopefully put this into a 1-slide synopsis to make it really simple. But what it is, just so you know, is a super critical extraction process from fish oil. So you can say, well, why don't I just take fish oil, Daniel? You need to take a ton of it if you're looking for this particular benefit, okay? So remember I said earlier, we go out here for these fancy nutrients to help. Well, this is one of those, and this is one of those that I'm excited about. Don't forget about the foundational components of what they're eating and lifestyle factors like that. But when they're in pain, this is a great way to go instead of, well, here's some Tylenol, here's some Advil, here's some whatever pharmaceutical drug they're going to put them on. SPM precursors. Upon active inflammation, the body converts these precursors to SPMs in the cell membrane. This is very specific, a little technical, not fair enough to do in a full 30 minutes, but we're going to give you the meat of it, okay? Here's what we need to know. First off, the companies that have them out there already, that have only 3 SPMs, they're telling you that they are the SPMs. They are the precursors. It's a little bit of mismarketing. So when you hear another company say, well, we already have the SPMs, nobody does. The body converts them. So be aware that if another person comes in and talks to you and says, we've got them, no, you don't. They have the precursors just like us. They have 3, we have 7. Then your body converts these, and the SPMs activate and finalize the resolution phase of the inflammatory cascade. So here's your stimulus. Here's where we put in the pharmaceutical drugs. Here's what these SPM precursors are doing, is taking these components, edema, fever, loss of function, and it's helping them get to the resolution of removal, restoration, regeneration, remission, relief. It is cleaning up the inflammatory process. The recommended dose is about 2 capsules in a chronic case. But here's a case that more did better. I always say, our culture is 1 is great, 6 is better. That's not always the case. This is the case if you are in active pain and they're willing to dose up. More did better. This is the power slide. This is the one to pay attention to. What happens with SPM precursors? A M1 macrophage is pro-inflammatory. So this is a macrophage process. This is an immune-based response. So an M1 macrophage, pro-inflammatory, produce inflammatory cytokines. Again, we talked about these. But what happens is these pro-inflammatory these SPMs, precursors, convert to an M2 macrophage. So pro-resolving mediators, these precursors, take the M1 to an M2 macrophage, which is anti-inflammatory. It does tissue remodeling. It's the resolution of inflammation. Produce anti-inflammatory cytokines. So SPMs activate M1 to M2. That's what you need to know. You can Google it. It's there. But check this out. Look at this literature. Look at this literature. Specialized pro-resolving lipid mediators, emerging therapeutic candidate for multiple sclerosis. Inflammation resolution and specialized pro-resolving lipid mediator for chronic rhinosinusitis. Huge. We've talked about sinusitis issues before. The regulatory effect of specialized pro-resolving mediators in immune cells. Look at this one. Specialized pro-resolving mediators in respiratory diseases. I don't know. I shouldn't get, I like getting excited about this. I really am. I mean, for you as a practitioner to have this tool in your toolbox, heck, for personal use, if nothing. But I think this is going to change the game for a lot of your patients who are in chronic pain, or those patients that come in acute pain and you adjust them, you do laser on them, you do whatever to have in your toolbox. This should be part of the package. Patients like a little bit of a package. They trust you. Make this part of your pain package. I just gave you 3 amazing products for a pain package. All right, so for those of you, I'm going to go to a few more slides, but I want to be fair because there's a lot of new names. Be ready to go in the chat box because I always do a raffle at the end. Okay, so just be aware. So the key clinical benefits: supports normal pain response, promotes tissue repair. You have an inflamed knee, helps the meniscus. Wow. Facilitates a healthy inflammatory response. It may address, there it is, age-related inflammation, physical stressors, pro-inflammatory diets. Oh my God, how perfect is that? It goes right back to slide 1. Basically, the golden arches breakfast that causes so much inflammation. We have to teach our patients to eat better. They need to make better choices. You will help them immensely. Here's your 7 identifiable and tested SPM precursors. I'm going to just share with you. We're using our ISO certified research lab, but we also have 2 other laboratories confirming the quality and the potency of this product. Here's your price point. $66.90 retail. Okay. 2 soft gels per day, 60 in a cap in a bottle. So price point, therapeutic value. I look at bang for the buck. I call this a solid one. Daniel gives this a check mark in his box because I know the people that are on here, you have patients that can fit this profile. All right. Raffle quiz time. the first to answer the chat box, win a bottle of Intenzyme Forte. It's a 100-tablet bottle. So like I told this nurse practitioner who's doing aesthetics, remember 5-BID for your long haulers or chronic pain in patients? This is perfect for him and his aesthetic patients, because I know there's some estheticians on here today. So here's Intenzyme Forte. It has all those enzymes to help with inflammatory response. Here's the question. How many SPM precursors are in the new Biomega SPM? 3, 5, or 7? My wife Jacqueline over here is on the computer letting all of you in, taking notes. I've not looked at the chat box yet. I apologize. I'll get to those questions in a few minutes. But I always like to announce who wins to make it fair game, that I just hold a raffle and I make sure the product gets out to you people. Do we have the winners? Okay, thank you. Nicole, Kara, and Sarah Glazer, you are the winners. I'm excited about that. I'm excited to have that product in your arsenal. If you haven't tried it, it's on my nightstand. I'm going to share with you. Intenzyme Forte is one of the products the vice president of biotics takes daily. Rarely, well, I've never heard of him being sick, because what are we doing? We're going in and digesting inflammatory responses. So a little piece of the information there. I was at a conference with him. He goes, Daniel, I take Intenzyme every day. You exercise every day. You have some level of inflammation. Intenzyme Forte to keep it in check. But now the new Biomega SPMs, you have the ultimate anti-inflammatory pain package. Okay. My next class is August 28th, and I hope this interests you. I just put this topic together because I have been getting inundated for years about products and protocols for pets. Now, why am I doing this? Because you're thinking, well, I don't have pets for patients. Your patients have pets, and your patients will spend a lot of money on their pets. I know this household does. They're laying over there, and they get more toys and better food than most people, okay? And they take a lot of supplements. And I want to share that with you because we got to take care of them too. I've always said we got to take care of our kids. Well, for a lot of people, pets are their kids. So products and protocols for pets. I have a dear friend, Dr. Dee Blanco, a brilliant integrative veterinarian up in Santa Fe. I've known her for over 20 years, and she's been in this industry for 40. She's written for Dogs Naturally Speak, has done webinars all over the world, and she is going to help me. I'm not sure if she's going to be able to hop on with this class, but she's going to help with the information for this class. I hope you join me, because again, I had a doctor who used to sell a product of ours and had a poster for pets in her clinic. She sold more of that product than she sold to her patients, because again, patients will pay for pets. And there's a lot of very effective supplements that will help with your pets. I hope this is exciting for you. You have my name, you have my email address, you have my cell phone number. Again, I'm very humbled for all of you to be here today. And I hope you learned a little bit. But if you'd like me to go further into the weeds with you personally, text me, email me, we'll set up a Zoom. And I appreciate all of your time. I'm going to end the recording now, and I will go into the chat box if there are any questions. Thank you all so much for being here today.